Good morning, everyone. Thank you for joining me today. I'm Deb Burton, owner, founder, creator of RI Elder Info and rielderinfo.com. We are the most comprehensive resource for seniors, caregivers, and professionals here in Rhode Island. Our mission is to be a comprehensive one-stop shop suite of information that can help people across the aging spectrum. So if you're a senior who wants to stay independent, if you're caring for an aging loved one, or if you're a professional who is working with those individuals, RI Elder Info is the place to be. We cannot do what we're doing in getting this information out to you if it weren't for our sponsors. So we're very grateful to Oak Street Health and Tamarisk Assisted Living, both great places. Of course, we have D&B Media behind the scenes here and England Studio. Um, Very grateful to all of their support. We couldn't do it without their help. Today, I have a wonderful guest who I personally have known for decades, but it's one of those strange things that we don't get together and talk shop. We talk family usually. So I would like to welcome my next guest for this week, Marjorie Waters from the Rhode Island Organizing Project. Welcome, Marjorie.
Thank you. Welcome. I'm happy to be here.
I'm happy to have you. So tell our viewers, what is the Rhode Island Organizing Project?
The Rhode Island Organizing Project is a nonprofit organization who's been around for really over 30 years in some form or fashion. And basically what our job is, what we do, is we go out and engage the community. We listen.
Yep.
And through the listening sessions that we have, we understand what are the issues and concerns of a community. And basically the backdrop to that is Voices for Better Health, which is an umbrella organization that we are in with the Economic Progress Institute and Senior Agenda. And our work revolves around the social determinants of health. So that's housing, food security, isolation, and transportation. And I've been doing this for 7 years. I love it. I have learned so much from the community members and really understand how resilient and adaptive our seniors and disabled adults are. So it's been quite a journey for me, quite a learning experience, and I'm very grateful for that.
So when you say that you are organizing people, what exactly are you organizing them to do? What are your focus areas?
So our focus areas are healthcare, to a lesser extent housing, but really transportation and other issues that just crop up. And basically we it's by consensus. So prior to COVID, we would go out to some of the senior high rises, have a meeting, listen to people as they discuss what concerns and issues they have as they try to stay in community as they age. And it's that if you hear it once, you note it, but when you hear the same issue continually, that raises it up for us as what we call an issue cut. So then we begin to work on it. We begin to organize. We ask other people, hey, we heard that, this was an issue for these folks. How about you? Have you had something similar happen to you? And really, that's how we build our coalitions. And once we've got an issue that we want to work on, we like I said, it's different under COVID, but we used to have mentoring. We would practice letter writing with people. We would practice how to make a phone call to your your Rhode Island representative or senator, hold rallies and meetings, engage, connect people also with resources that they may need. In some cases, sometimes it's not a consensus issue, but it's something that they just don't know what the right resource is. Who do I call regarding this?
So it sounds like, where a lot of organizations will say, here's our mission and rally people behind them. It sounds like the way the Rhode Island Organizing Project is working is you're really speaking to people in the community to find out what concerns them and then identify if this is something that other people are experiencing, and then really speaking to them to see how do they want to solve it. More of an empowering way. Is that correct?
Yeah. Oftentimes when somebody mentions an issue or tells us a story about an experience that they've had, we get into how did that make you feel? And if you could do something about it, what would that be? So we really, although we don't get it deep into problem solving, initially, we want people to connect with how that incident or issue made them feel, because that's empowering too. I feel like I didn't have any power. I felt like they weren't listening to me. I don't know who to call about this. So there are all of those issues, and we work through them one by one. We have a program called Lift Up Your Voice, and that really engages people on who the players are in Rhode Island. Who are, the Medicaid, who are the folks that make the decisions that impact your life.
Mhm.
You know what I mean? And giving them the tools to engage those individuals in a positive and productive way. So that's really, we talk about that 2-minute elevator speech.
Yeah, I
We
hear that
really train
all
our
the time.
people. We really train our people to be brief. Okay, you got me in an elevator. What do you have to say? So we practice those things so that people feel comfortable telling their story in a very succinct way.
Yep. What age groups do you work with? Are there specific populations that you work with? Who are your clients?
They're primarily duals, primarily people who have both Medicare and Medicaid.
Mhm.
Due to, we're a staff of two. So I have worked primarily in the high rises, and, we're, elderly and disabled people, because we also work with disabled adults. So on the disabled adult side, there isn't a age limit per se, but we tend to work with older disabled adults and then seniors and in general in the population. I just want to give a shout out to the resident service coordinators who are in those buildings. They do an absolutely marvelous job. And without them, my work would be much more difficult.
Yeah, the resident service coordinators really are unsung heroes. I don't know, right through the pandemic, if some were not able to remain in the building during the initial outbreak of COVID, but they've remained available and are always looking for ways to really advocate for their residents. The RSCs are awesome.
Yes, they are. So I know I am very fortunate that I have an excellent relationship with many RSCs and the Risk Association, which is the umbrella organization for Rhode Island RSCs.
Mhm.
And they're also an excellent conduit for me to get information out there. You know what I mean? I might send a flyer and say, "Can you post this?" Or if there's enough interest, we might do a community call on that subject. So we really try to listen to the community and respond to what we've heard. That's probably the primary goal of us. And then, like I said, empowering people to be part of the change that they want to see.
I think that having the individual voices, I think that's one of the things that's really important. I know for what we do here at RA Elder Info, it's, really give people the information that they need that will help them make informed choices about their life. We don't have to be parents to other individuals. That's not something that we need to undertake. Can you give examples of the types of things that you've worked on?
One of them was the no fare bus pass, which was early on. We fought hard. We organized people around the no fare bus pass. We had many, many meetings with RIPTA. The state of Rhode Island was involved. They helped us to determine fact from fiction, because there was a lot of fiction floating around this program, and really told the stories of the individuals and how devastating it would be if this program ceased to exist. So actually, the no fare did go away briefly. And I was a newer organizer then. I was really discouraged and say, why are we still fighting this battle? It's over. But it wasn't over. And as soon as they stopped the no fare bus pass, the stories began to come in. People couldn't access food pantries. They were struggling to pick up their kids after school. They couldn't get to their doctor's appointments. So pretty quickly, it was rescinded and the no fare bus pass was reenacted. So that was probably one of our biggest successes. And also, it encompassed, basically a 2-year campaign. So nothing we do is slow. Usually the campaigns is quick. Usually the campaigns last several years, several months at the shortest, but several years is the norm for us.
So, what kind of projects? I saw in the paper that Rhode Island Organizing Project just got a part of a larger grant. What projects are you working on now? What's on your agenda for 2021?
So we are working on actually, we've got a pretty full plate where we're working on the Raise the Bar, which is to try to get more hours of care in nursing homes. We're also, involved in the Fight for 15, and that's better wages for the people that care for our loved ones, a $15 minimum, which is $30,000 a year. So it's not a lot, but it's much more than their people are making today. We also are engaged in looking at and fielding concerns and issues about the redesign of Kennedy Plaza. That's a fairly new one that's come to us, and really trying to determine by talking to the community, what will the impact be to you, to seniors, to people with disabilities. The great concern about that is, how do we get from one bus stop to another? Somebody likened it to running to the airport trying to catch a connecting flight. So there's real anxiety around it. We know that this isn't a project that will happen tomorrow, but we really want to make sure that people are heard and that their concerns are heard by the people who are making this decision.
Wow.
Um,
So, I just want to back up a minute. So, you mentioned two things that can kind of be hot button issues. The minimum staffing for CNAs, the minimum CNA staffing in long-term care. I personally, because I follow a lot of the data from CMS, I was really excited when CMS changed their regulations that they had waived during COVID, which did, during COVID, they waived facilities' requirement to report their staffing data. And CMS reversed that order, I think it was in September. So now CMS.gov, you can get the staffing data for how many nurses are on duty, as far as how much care is provided to the individuals in nursing homes. So I was glad to see that. But the minimum staffing, that's one of those hot button issues, because there's a question of, if we mandate staffing but we don't have enough staffing, would we really be locking in our healthcare staff into mandatory overtime or mandatory shifts? Can you speak about that a little bit?
Well, we have talked a great deal to not only the CNAs who work in nursing homes, but also many, many people who have families in nursing homes. And a lot of this was I know I visited nursing homes pretty frequently before COVID. And often, the staffing issue is a big one. I understand the struggle. It was a problem before COVID. It's become critical after COVID. But my concern always has to turn back to the community, and that would be the people who have loved ones in nursing homes and those that are there. And CNAs are telling us that sometimes they don't have enough time to complete what we call ADLs, activities of daily living, washing, dressing, feeding, getting their hair combed and their teeth brushed and things like that. So they're rushing through this. So there's almost no time for them to talk to the person as a human being, saying, how you doing? Have you heard from your family? We've heard of staffing ratios of 1 CNA to 13 patients. And
Wow.
that's just not sustainable. So I understand the pain of the nursing homes. This has been a terrible time for them, both because of COVID, because of staff sickness, and people quitting because they're afraid. So if you have people that are in there and showing up for work every single day, let's acknowledge that by giving them a living wage.
Right.
And also, what I've heard is the stress and anxiety of trying to care for so many people and just trying to meet their basic needs gives them no time to do the social isolation stuff, like talking to them. And CNAs, they know that, and they're pained by that.
Mhm.
So I think that I know it's a stretch. I know that um, many people say it's not the solution to the problem, but I don't think there's one grand solution. I think we have to take tiny steps towards making it better for both the patients and the people who provide the care.
Yeah, and you touched on it real quick, the living wage, the $15 an hour. I think one thing, um, you know, when you work in this industry like we do, we already knew that in order to survive, many CNAs worked multiple jobs. So they would, be at one facility during the morning, another facility for the second shift. They would pick up private duty home care just to survive.
Right.
Uh,
And especially going from facility to facility, to me, that exacerbated the COVID outbreak because, people are asymptomatic. I had a good friend who was in a nursing home. She caught COVID. I was very afraid, but she virtually had no symptoms. So those people continued to go to work, not knowing that they had COVID from one facility to another. And that's part of the community spread. When we say community spread, we don't just mean out there, we mean everywhere. So that's one of the challenges that nursing homes have had to face is how to better test their staff. And but it's difficult for the staff to stay home when they're sick because many of them do not have any sick time. And with the pay scale, they feel that they need to continue working. So it's caused a real conundrum. Like I said, I don't have the answer. I think it's going to be many steps towards a positive resolution to some of these issues.
and what are some of the successes? You had mentioned the No Fare Bus Pass. What else has Rhode Island Organizing Project been successful in making changes for folks?
We really during the previous budget cut, when we're looking at things like senior centers getting cut, Meals on Wheels was getting their budgets cut. Um, um, the program that helps relieve caregivers, that was facing cuts. So we really did a massive campaign on that. We did a drive for postcards, and we were able to deliver cards, stacks of cards that look like this, to the State House in person. These are the people that care about these issues and want you to maintain the funding for these programs. And it happened. So sometimes the things we do are not known widely throughout the state, but they are known to the people who were concerned enough about the issue to sign the postcards, to maybe make a phone call, send an email saying that, you know, we care about this issue. Please don't cut the funding. This is so meaningful to so many seniors and disabled adults. And so, the subtleties are there. We also do, on occasion, some lobbying directly on an issue that we care about. So really, we work on issues that are raised by the community. Unlike some organizers, we don't go in there with issues, and say, here's an issue. How many people, want to work on this? We ask, what are your issues? We ask, what are your concerns? And then, like I said, through talking to hundreds of people we decide how many people are affected by this, and can we move the mark? That's the other thing. We don't take on projects that we don't have the personnel to fight, or that it's a federal issue. We really try to stick to the state issues that impact people where they live.
And does Rhode Island Organizing Project, you had mentioned that you work with individuals who have Medicare and Medicaid. Do you have particular focus to amplify the voices of the minority population, perhaps individuals of color or non-English speaking or limited English proficiency?
Unfortunately, we did have a bilingual person who, due to the pandemic and having a young child, had to leave the organization. That's something that I've always been concerned about, is the outreach to um, the Spanish community, because one of the things we hear constantly is communication. People don't feel like they're getting the information they need to make good decisions. And oftentimes when they get the information, it is so complicated and so full of jargon known only to the people who wrote the item that it's incomprehensible. So I call it gisting. So we take that information and we try to gist it down to its essence. We try to use plain English, and then sometimes that's what we talk about. So we make it a pretty complex flyer, say from the independent provider model, but we really try to break it down to its essence and then distribute that to the community along with the original document.
Yep.
But so that's been a big frustration. Because of the population we work with, these people often don't have the technology.
Mm-hmm.
No. So they don't have laptops, they don't have smartphones, they don't have internet access. So as we see things constantly trending to, it's on the web, it's on the web, it's on the web. These people are not on the web. So how do you communicate with them? And that's been a real challenge because, usually there's a lot of silence when I mention, I'll go to a meeting with 20 people and maybe 3 or 4 have internet access and technology. The rest don't. So how do we message to them? Which has become really critical in the age of COVID, that people get the correct information. So that's an ongoing struggle. I know lots of things. We're not the only people reaching out, but I think we're unique in that we're reaching out with information that people want and need. So the two-way conversation. We listen and then we tell you, here's what we know. Here's what's going on. Here's what we're working on. And that seems to be valuable. Our community calls have been very successful. People have been on the call since March. Some people called it a lifeline. Some people called it's not only communication, but it builds camaraderie among people. So they're talking to each other now, outside of the call. They're problem solving. They're coming up with ideas. So it's really a wonderful thing to have that developed. And the calls are open. They happen on Tuesdays and Thursdays. Open to anybody in the community. There's flyers up in all the buildings. Always the same number. Always the same code.
What is that number?
I knew you would ask me that.
It sounds like you have a lot of irons in the fire, and they're all really needed. And I know that you are super passionate about these things. Would you feel comfortable sharing what drew you into this? What made you want to be the voice for our older adults? Or actually, let me take that back. Not be the voice for our older adults, but to help older adults amplify their own voices.
Okay. My mom got very ill. She had a stroke when she was 68. And first, she went through the whole rehab procedure. But we were able, fortunately, because of the size of our family, to care for her at home, where she lived another 20 years. She outlived some of the people who had treated her, and her prognosis was not good. So that was the beginning of understanding how aging people are treated in nursing homes and rehab centers and hospitals. From there, I became the senior center director of Westminster Senior Center, which is now closed. It was a small private senior center, probably 96% Spanish speaking. So I did start speaking Spanish and learn to speak Spanish, but I haven't spoken it so long, I'm losing it. But that really, it was a healing for me because I had just lost my mother. And I really got engaged with the everyday issues that our seniors and disabled people face. During that time, I met Ray Gagnon, who's the executive director of Rhode Island Organizing Project. And after the senior center closed, my sister became very ill with ALS, and I lost her in 2013. I cared for her so, God works in mysterious ways. The senior center closed, I was out of a job, and I was able to care for my sister. So, once again, understanding the challenges for somebody who's a little bit older to get through the medical system, especially at the time she didn't have insurance. So that fired me up. And when Ray asked me to become an organizer under the Voices for Better Health, I was thrilled at the opportunity. And I love it. I love what I'm doing. I'm hoping it makes a difference for many people. And it's just where I want to be. It's what I want to do.
I'm very grateful that you are doing this position because I know what a great advocate you are. I've witnessed that firsthand, and I'm really glad that you were able to join us today. Now, you had mentioned the Rhode Island Organizing Project is a nonprofit. So if people wanted to support the work that you're doing, if they wanted to get involved to help amplify the voices of our older adults and individuals in need, how can they contact you? What would be helpful? Do you need donations? Do you need volunteers? What would you need to expand what you're doing?
We normally don't solicit, donations. We don't have a fundraiser or anything like that. We have private donations, which give us the freedom to speak freely. So by not taking state or federal money, sometimes there are allies and sometimes we're in opposition. So the freedom it gives us to speak our minds on issues that are presented to us is really, wonderful. If you want to become engaged in an issue, or an issue that's affecting you and people around you, we encourage you to reach out to us. Our number is 401-351-5577.
That's awesome.
And the email is also there. So, and ongoing, we, in addition to working on projects, we monitor, I guess is the best. So for instance, for MTM, a lot of people call us with issues and complaints. And there again, it's, you get a call from one person, you say, maybe that's a one-off. But when you get 10 calls on the same issue, or 20, something's up. And so then we may reach out to the state and to MTM and give them, here's what we're hearing,
MTM, for those who don't know, MTM is the state Medicaid and elderly transportation system. They provide free rides to folks to non-emergency medical visits.
Right. And the free rides are Medicaid only, but they have another program called the Elderly Transportation Program. And that program is for people who are not Medicaid eligible, but still low income. I believe the age is over 62, and they can get transportation, $2 there, $2 back. So round trip is $4. But we've been challenging the state on why are you even collecting that? Who does it, we ask, who does it go to? Does it go to the driver? Does it go to the, so with that kind, I think they put that in there to kind of distinguish the two programs. But, anecdotally, I hear that oftentimes that fee is not collected. So I want people to know that there is a ride program available for you, even if you're not on Medicaid, and that's called the Elderly Transportation Program. And it's under the umbrella of the MTM, which is, as Deborah stated, was part of the state transportation program. So, but information like that is often not getting out there. So people don't know. So, sometimes I feel like maybe I'm stating the obvious, but oftentimes I always find somebody who did not understand or know that resource was out there. The other thing that has come up was for younger Medicare only people. They did not realize that Medicare does not pay for long-term services and supports.
If I had a dime for every time I said that, I could have a beachfront property. So many
So,
folks that could say it again.
yeah. So that's really important. Medicare does not pay for long-term services and supports, which is care in your home. That is a benefit that right now is Medicaid only. There are some circumstances for a limited time you can receive care at home, and that's usually after a hospitalization, you know. But I have read information about, well, you can get it from Medicare if you do this and you do that, but I know of no one who has successfully gotten long-term care in their home through Medicare. So as people plan, as they age, that's a really important thing to know. And I was surprised how many people didn't know that.
Yeah, and I think the other thing, because Medicare doesn't pay long-term care, which wow, we could have a whole nother hour-long discussion on that. We don't realize that if you're not making progress, everybody thinks, oh, 120 days are going to be paid under Medicare. No, 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 no. And it's not 120 days fully paid either. But it's really important that an individual continue to make progress. Just because maybe you broke your hip and you're not able to walk again and your bathroom is upstairs does not mean that you'll be staying in the nursing home. And if you think about once your Medicare coverage ends, you now have to pay privately. On
Yes.
average, that, is $312 per day in Rhode Island. So you're looking at like 10 grand a month. So you're right. People don't realize that. And that's something that, I'm glad that you're raising awareness for. That's huge.
The other program that people don't seem to be aware of is it's a clunky name, At Home Cost Share Program. And what that is for people on Medicare only, but lower income, so they just miss the Medicare cutoff. This program pays for a substantial portion of your at-home care. So, for instance, if somebody comes in and I'm say $20 an hour, they will pay up to 3/4 of that sometimes. Or there's a set fee. So I'm paying 30, I only have to pay $7.50 out of my pocket. And I'm just using this as an example. They may not be on, but it allows people who for at-home care would be out of reach, allows them to get some at-home care at a very reasonable cost. So once again, that's a program that many people don't know about. I encourage people to become familiar with the program for yourself or somebody that you love, because it's an excellent program. But like I said, underutilized because people simply don't know it's out there.
Yeah. Yeah. And I love that this is, a lot of as everybody can see who's watching, like there's so many different layers of information that people need and concerns and issues that people need raised to the powers that be. I am really glad that the Rhode Island Organizing Project is out there to really facilitate that for folks.
So it's been quite a wind up because in the beginning I had some medical background because of what we dealt with my mom, so understanding the bureaucracy and how to get things done. But now certainly my knowledge has expanded tenfold. And like I said, the biggest issue I see for folks, there are resources out there that may help many people, but they simply don't know it exists. you
Yeah,
know
yeah,
so I encourage people listening to reach out to Rhode Island Organizing Project, because at least we can explain to you what the resource is and how to access it.
yeah.
That's kind of what we do too. Is we ourselves are not the resource, we can't, but we can tell you who to speak to resolve the issue.
Yes. And I'm sure that you also tell people about RI Elder Info. Heidi
And
Ross mentioned something. She wanted to let people know that under Medicare, if someone needs hospice, Medicare will cover hospice care if that's something that is appropriate for you or your loved one. And If you're not clear on what Medicare program is best for you, there are SHIP, SHIP, Senior Health Insurance Patrol counselors that are available at many different state agencies who can help provide some insight so you can make an informed choice. So
That's
thank you, Heidi, for that.
That's really important. When I turned 65, having done this for a while now, I still threw up my hands and said, I don't know what to do. So I did go to the point and SHIP counseling. And I'm so glad I did, because I had a tendency to want to over insure myself. And so, they tell you things like bring in all your medications. And I wanted the experience, this is what the community goes through. I wanted that experience. So when I showed up for my counseling appointment, I plunked down my one prescription, and they were like, that's it? Why do you want all this insurance if you're basically healthy? And then they explained, if you can change your coverage, on a yearly basis, there's open enrollment. And I knew that, but it was so reassuring to have an expert, verify my thoughts. So it was very valuable to me. It saved me some money. I understand how this whole Medicare open enrollment works better. And, I relay that to the people I talk to. So having those personal experiences myself really helps me to reach out to other people and explain to them, here's what I experienced.
Yeah. Yeah. And I think it helps people trust a little bit more in the information that you're providing because you've experienced it yourself. That's absolutely.
Right.
We have covered a lot of information today. This has been awesome. Any final thoughts?
Just a couple of things. Once again, I wanted to talk about the IP program,
Oh, yeah.
which allows a person to select who they want to care for them. So in this scenario, it's often family, friends, close associates who may be doing that work anyway and caring for somebody. It's the opportunity to get them some training, which is required, and then they can actually work for their loved one and get paid via Medicaid for that work. So in my example, if that program had been around when I was unemployed, I would have definitely taken the training and been my sister's official, PA, personal assistant, during the time she had ALS. So it's a really important program that's just getting started. We've heard so many people say, I don't want strangers in my home, and they forego at-home care because of that fear. So we've already had 60 people who are moving through that process, and they call them dyads, which is a strange name, but it's basically they've already peered up. They know who they want to care for them, and they are now going through the process of getting the caregiver trained and getting the patient enrolled in this particular program. So once again, I encourage people to reach out to us. The IP program is on the state website, which doesn't do a lot of people a lot of good, like I said, if you don't have the technology. But please call us. We actually send out flyers and information via regular mail.
That old school. And
Old school.
whatever it takes to get people the information that they
Yes.
need.
Yes.
That I think is really the most important thing. Margie, this has been great having you on today. And I encourage people, she's real. And she says, you can call her and she
Yeah.
will answer the phone.
Yes, I will answer. I will always answer the phone. And I will promise you, if I don't know the answer, I will find the answer for you.
Yes. Yes. Thank you so much for joining me today, Marjorie.
Thanks so much for having me, Deb.
This has been great. Thank you.
Yeah, thank you.
So everybody, as you see, we covered a whole slew of information today. Really important that you hit the like button and that you share this video, because you can just tell there's so much information, from the independent provider model to having the actual community voices uplifted, to why it's important to pay $15 an hour, a living wage, to why it's important to have some minimum staffing guidelines in our long-term care. We covered so much today that I am 100% confident that there's somebody that that needs the information that we talked about today. So I thank you all for joining us, and I look forward to seeing you all again next week. Have a great day.
If you liked this video, please follow us on social media and subscribe on YouTube. For more information, visit rielderinfo.com or call 401-585-0509. If you have any questions, email deb@rielderinfo.com.